This is your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how to increase work productivity as an X-ray tech by understanding how your hospital works or operates. So to give you context, I am a night shift X-ray tech. I've been doing it for over 4 years now at a trauma 3 ER. So the most common issue every single person in our department, and I'm talking about CAT scan, ultrasound, everyone in our field, is the nurses are always in your way. That is the most common problem. Sometimes the doctor, but majority of the times is the nurses because they do a lot of labs, patient care, or whatever they got going on. So, with that being said, if you're new, depending on your shift, not obviously someone who works nighttime versus daytime, you will just have to understand. I've worked ungodly amount of overtime, so I kind of understand the pacing on both teams. So essentially, when you get an order in, and once again, it all depends on the doctors too, because some doctors will order everything at one single time, including x-rays, labs, and everyone, and it's kind of a free-for-all, whoever gets them first. Other times, certain doctors, as they assess, they order stuff, and by the time you get there, no one's in there, all the labs are completed, and you won't have to deal with it. Other times, there will be no orders, and they'll just call you, hey, can you shoot someone? And it all kind of depends because they're in the trauma room or whatever. So it all kind of depends on your pacing. Other times, if they order something, you can look in the patient's chart and you can see, oh, they ordered labs. Oh, they ordered labs, but they've been collected. Or, oh, they've ordered medication, pain meds or whatever. And you can kind of understand, like, to save you a trip from going all the way to wherever the room is and then coming right back or having to wait. Just to make it easier on yourself. You can kind of see where they're at and you can kind of adjust your pacing like that. And then sometimes, depending on who the nurse is, you can already gauge on how they work, if they'll let you squeeze in or if they don't. There's certain nurses that they'll tell you, oh, it'll be a minute. That means 30 minutes. Other nurses, it'll be a minute, and it will literally be just a minute. And then there's other nurses that just don't like our department. You'll find them everywhere. So you just have to gauge or build better relationship with some of these nurses. Other nurses, they'll be kind of like the newer ones, won't know how we operate, but if it's just a 1-view chest x-ray and you do it within 30 seconds, they're like, ah, cool. If that's all you're doing, I can let you squeeze in, and then you're like, yeah, we already told you, we're quick with it, Other exams, obviously they take a little bit longer or whatever equipment you got. So there's always that. Let's see what else could help you. Depending, like for instance, me, I do morning ports and I have to deal with a bunch of orders on 2 different sides of the hospital. So what I do, I move all the orders over, and then on the actual X-ray portable machine, I'll begin them, but suspend them, and then that's just one less clicking you have to do when you can just pull it up and just shoot. Depending on how your X-ray board is placed behind the patient, there's 2 different sides. Our X-ray board has a little grid holder, and if you flip it upside down when you shoot it, the image will spawn in correctly. Other times, if it's flipped, the image will show up upside down and you'll have to click the image to flip it over. Now, obviously, you may be shaving off maybe 10, 20 seconds off of the situation, and it's something little, but it's one less clicking, and nothing is more easier than when you shoot it and the image spawns in, you look at it and it's good, and you just hit complete and you just kind of keep it pushing, Now, let's see what else. So also on your portable, if you have lead and it's in front anything, if it's on the side, it will be on your way, and you'd be amazed of how much field it can cover just having the LED sideways. I would always recommend hanging it from the front, and some of them have magnets on the LED. You can just kind of like stick it on the portable so it takes less room, because sometimes you'll turn corners and the LED will kind of swing off to the side, and God forbid you run over a nurse or you hit some equipment and then your machine starts beeping and making noise. If you're shooting X-rays, and depending on how your system works, we have like Fuji's at ours. If you switch from like the big X-ray board to the PD board and you have to swap out the battery, make sure you connect the big board and then pull out the battery, or else you'll have to it'll just have to reboot and connect to the system. That will save you a headache too. When you're shooting exams, if both of the platelets are connected to it, you have to make sure that you're clicking the right one, because sometimes if you shoot something, it will switch to the PD board and vice versa. So you always gotta look. Certain exams will do that, because sometimes we'll shoot hands on the PD board to make it easier, but you'll have to click every single time to the PD board because it'll automatically go to the 14x17. It's just a headache we have to deal with. Let's see what else. What else we got going on? There's not that many things I don't think there's that much other stuff, because some of it is kind of very niche to the system you use. Because, like, for instance, if Fuji versus GE, the portables operate different and they use different things. Like, for instance, on my Fujis, for certain exams, you just have to shoot it hotter to get an more optimal exam, especially if they have hardware in their body. But then again, we have two Fujis that are the same, and because they're both shitty and different pieces of equipment have been replaced, you all shoot differently. So I can't even give you advice on that either that much, because it's all kind of, trial and error as you learn better your system and stuff like that. Let's see what else. That's all I could think of all the little things I've ran into that makes it easier. Oh, and then I have this that I came across because I drive the portable. It's a little clip, and you can stick it on the portable where you grip it, and it'll save your wrist tremendously. Obviously, it's not that hard just to go like this and drive it, but then I've noticed that your forearms slowly start to wear out, especially all night running around with the portable. This will like make it super easier. It literally costs $1 at the store. Like, it saves tremendously your strength and all that. And that's about it, all I got for you. If you enjoyed today's video, you can check out my other videos in this beautiful world of radiology, and we'll see you on the next one.